Just one more of these, because I gotta get on with my day. Trying to stop drug pushers, especially of $1 million or $1 billion industry, from pushing lies on the social media they own and control. It's like trying to stop the tide from coming in. But I will still dispute these irrational and illogical statements issued by medical establishment talking heads. So, in Googling marijuana legalization increasing cannabis adverse effects, I came upon a long-term study since California voted to legalize in 1996. Changes in healthcare encounter rates, possibly related to cannabis or alcohol following legalization of recreational marijuana in Safety Net Hospital. Hopefully I can just scroll down this way. No, it's got to be an asshole. Wait, let's try it like that. Okay, abstract. Liberalization of marijuana laws in Colorado contributed to increases in cannabis-related adverse events over time. This is tangibly observable on so many levels and in so many ways. Not just the admittance of cannabinoid hyperemesis increasing and all that stuff, but other ways as well. We examined characteristics of patients with healthcare encounters possibly related to cannabis and assessed the temporal association between legalization of recreational marijuana and healthcare encounters possibly attributed to cannabis. Methods, annual encounter rates possibly related to cannabis and alcohol were compared using negative binomial regression. 2 time intervals, pre and post recreational marijuana legalization, January 2009 to December 2013, and January 2014 to December 2015, respectively, were used to examine changes in monthly rates of emergency encounters and hospitalizations possibly related to cannabis. Level and trend changes on encounter rates by legalization period were assessed using interrupted time series analysis. Encounters possibly related to alcohol were used as a comparator group. That is a key detail. Results. Most encounters identified during the study period had alcohol-related international classification of diseases and procedurals, codes 94.8% versus 5.2% to cannabis. Patients with encounters possibly related to cannabis were younger, more likely to be hospitalized, and more likely to be admitted to the psychiatric unit than patients with encounters possibly related to alcohol. Now, keep that in mind. More likely to be admitted to the psychiatric unit than patients with encounters possibly related to alcohol. Do you know why? Alcohol doesn't cause psychosis the way marijuana does. When I was alcoholic, it quieted the voices. They used to use opiates for the same reason, morphine, to treat schizophrenia in the late 1800s. This fucking psychiatrist is so full of shit. Initial and sustained effects of encounter rates possibly related to cannabis demonstrated an increased trend in slope before and after recreational marijuana legalization. The slope became more abrupt following legalization, with significant increase in trend during the post-legalization period. No significant changes were noted for encounters possibly related to alcohol. Changes in undergraduates' marijuana, heavy alcohol, and cigarette use following the legalization of recreational marijuana in Oregon. Rates of marijuana use increased pre to post 2015 at 6 of the 7 universities, a trend that was significant overall. Increases in rates of marijuana use were significantly greater in Oregon than in comparison institutions, but only among students reporting recent heavy alcohol use. Conclusion, rates of Oregon students' marijuana use increased relative to that of other states following recreational marijuana legalization in 2015, but only for those who reported heavy alcohol use. Of course, that is contingent on the honesty of self-reporting. Modes of marijuana consumption. Proliferated. These yeah, that's something we should all already know about. The increased health risks that have been occurring, like acute and chronic effects of cannabinoids on human cognition. Yeah. Verbal learning and memory and attention are most consistently impaired by acute and chronic exposure to cannabis. It causes an IQ decline. These psychiatrists don't give a shit. Like, marijuana use trajectories among academic outcomes among college students. Students who use marijuana frequently at the beginning of college career are especially at risk for lower academic achievement than non-users, suggesting that early intervention is critical. Corpus callosum microstructure. Frequent use of high-potency cannabis is associated with disturbed colossal microstructural organization in individuals with and without psychosis. Yeah. What the fuck? Like, how did the Mr. Shekel junkie goblin psychiatrist not know all this stuff? These is fucking, like, well-publicized studies, according to him. Adolescent cannabis use is a better marker of lower educational attainment than adolescent alcohol use, and identifies as an important target population for preventative intervention. Oh, weed is actually worse than alcohol for that. Marijuana smokers had poor executive function relative to control participants, a between-group difference that was primarily driven by individuals with early onset of marijuana use, 416. Cannabis use among Swedish men and adolescents and the risk of adverse life course outcomes results from 20-year follow-up study. Heavy cannabis use among Swedish men in late adolescence appears to be associated with unemployment and being in need of social welfare assistance in adulthood. These associations are not explained by other health-related social or behavioral problems. Results support a growing body of work suggesting frequent marijuana use predicts a likelihood of post-secondary educational attainment, and this difference may originate during secondary school. Morphological disorder, hippocampal, episodic memory deficits and hippocampal morphological differences in healthy individuals and schizophrenia subjects. So you got the control group, and yeah. A past history of cannabis use disorder may be associated with notable differences in hippocampal morphology and EM impairments among adults with and without schizophrenia. Cannabis use is quantitatively associated with nucleus accumbens and amygdala abnormalities in young adult recreational users. This data suggests that marijuana exposure, even in young recreational users, is associated with exposure-dependent alterations of the neural matrix of Corey-Ward structures, and it's consistent with animal studies of changes in dendritic absorption. Long-term effects of cannabis on brain structure. We provide evidence that regular cannabis is associated with gray matter volume reduction in the medial temporal cortex, temporal pole, parahippocampal gyrus insula, and orbitofrontal cortex. These regions are rich in cannabinoid receptors and functionally associated with motivational, emotional, and affective processing. Demonstrated by neuropsychological tests, neurospect imaging, adolescent marijuana users demonstrate less cognitive capacity related to the process of learning, such as attention, concentration, ranking, visual spatial integration, immediate retention, and visual memory. The differences between both groups are statistically significant. Cannabis use, like, who doesn't know that? But of course, Dr. Shekel Grabber there would push it on anybody. I mean, he is. That's what his YouTube channel does. Chronic cannabis use when starting before age 15 may have more deleterious effects on neurocognitive functioning. Yeah, who doesn't know that? Age of onset of marijuana use and executive function. Findings suggest that earlier marijuana onset is related to poorer cognitive function and increased frequency and magnitude of marijuana use relative to later marijuana onset. Sorry about that. I had to get on with my day. Just running out of time for the TikTok 10-minute time limit. It just goes on and on and on. That was page 20 or something out of 168 pages. So the doctor knows he's lying. Like, there's no way he could not know that he's lying when he pushes legalizing marijuana as a psychiatrist.